The last major go-live for Cone Health Link takes place on November 4th. We'll check in on the preparations, plus a look at where the Alamance Regional Medical Center Cone Health deal stands. All of that, plus a new Cone Health website in this month's Code View. Cone Health Link finally becomes the all-encompassing electronic medical record system for Cone Health on November 4th. That's when the system goes live at Moses Cone Hospital, Wesley Long Hospital, and Cone Health Behavioral Health Hospital, the final big pieces of the network. It's a day that a lot of people are looking forward to.
I think it will help efficiency for order entry. For the most part, I think it will have a smooth transition for patient care when it comes to entering an order and having one patient, one chart. I'm excited.
I think it'll be a good change. I think it'll be one record, one medical record, and it'll make things smoother for the lab. We'll have less manual orders and stuff that we deal with and everything, so we're really excited for it.
I found Epic a little daunting at first, but overall a great product. I think it's going to increase our productivity over time and cut out a lot of the redundancy in paperwork.
I'm very excited. I've been very involved with the AnyPen Go Live, and I've been involved with the planning for this Go Live, and I'm very excited about it. I think it's a good opportunity for all of the floors and the staff to get on the same page and make care for our patients better than it is right now.
I'm very excited. This is a new system that we're having that's going to combine all of our systems where they can all talk together. It's going to be electronic documentation, so everything is computerized, no more papers, saving the trees. I love it.
Once this go-live is completed, work begins on updates, then rolling out the ability for patients to be able to look at their medical records via computer from home. That future ability will eventually be available at conehealth.com. For now, the Cone Health external website has an entirely new look. The new conehealth.com went online at the end of October. The new website makes it much easier to sign up for community education classes and learn more about the services available through the Cone Health Network.
We created it with the end user, the consumer in mind. We wanted a website that would be crisp, clear, easy for them to navigate. We wanted a website that would very efficiently tell the Cone Health story, and we also wanted a website that would engage or draw our marketplace into the website.
One of the cool features is that the format of the website automatically changes to look great on smartphones and tablets, as well as on PCs. The Federal Trade Commission wants more information regarding the Cone Health Alamance Regional Medical Center merger. A lot more. It looks like meeting that request is going to take months.
Both Alamance and Cone received the request. There are many, many lines spelled out of items on this sheet that we have to go ahead and provide to them. A lot of data that's going to be hard for us to get. Some of it's electronic, but some of it's information we'll have to go out and find. It will take us a couple of months just to get the data together and to coordinate that with Alamance and to get that back to the FTC.
Rice says planning and preliminary merger work between Cone Health and Alamance Regional Medical Center continues. North Tower opens early summer, but part of the $20 million addition to Moses Cone Hospital is open today. Emergency Department Pod A is in service. It's a 13-room addition.
Very excited. It's cut our ratios down to 4 to 1, so nurses can see the patients more often. Take a higher acuity, so they only have 4 patients in that respect. Also the techs, 4 to 1. So I think the staff morale will go up from here.
Pod A features private rooms for patients. It opened early to allow construction of a hallway that will connect North Tower to the rest of Moses Cone Hospital. Don't forget to roll up those sleeves and get your flu shot. Cone Health requires all employees be vaccinated against the flu to protect our patients and one another. Shots are available in the solarium of Moses Cone Hospital through January 4th. Paul Jeffrey has a new title. He remains president of Wesley Long Hospital, but is also Cone Health's first Chief Inclusion Officer. As such, he will create and oversee diversity initiatives for Cone Health. Jeffrey points out that these efforts directly improve care for our patients.
With the goal of reducing the number of readmissions. reducing the average length of stay of our patients in our hospitals. But if we are not aware and do not understand the different cultures, the differences that some of our patients have, the different challenges that our patients have, we may not be able to provide the necessary help that they need.
Jeffrey has already formed an inclusion council. Part of its mission is to make sure patients are treated how they want to be treated, not how we want to treat them. The first part of this year's modified and simplified United Way campaign is over. Still, the books remain open to help employees reach that $640,000 goal.
And we want to make sure that people know that we can still collect those dollars because we want to make sure that we meet our contribution goal. And we're very close, we're gaining every day, and we've actually, proud to say, we've had more cornerstone givers in the Cone Health system than we've ever had before. So those are greater donations from a greater number of people.
If you haven't already, you can pledge by going to the Intranet homepage and clicking on the United Way logo. The 20th Women's Only 5K Walk and Run goes into the record books as one of the biggest and best ever. A record 3,716 women took part. They raised more than $118,000 for the Mammography Scholarship Fund at Women's Hospital. That fund helps provide mammograms to women who might not otherwise be able to afford one.
This really is bringing our value of caring for our community to life. And it's just so rewarding to see so many breast cancer survivors there as well. They are a true testament to inspiration and hope for other women.
In case you're wondering, October 5th, 2013 is the next Women's Only 5K Walk and Run. Mark your calendar now. That's it for this edition of Code View. I'm Doug Allred, and I will see you next time.
You guys were booking. Everybody, let's give them a nice round of applause. Our top 3 winners for the Women's Only 5K Walk and Run 2012.